So what labs do you screen if you're worried about rheumatoid arthritis? Hello, this is Dr. Siddharth Tambar, expert in rheumatology as well as regenerative medicine. So, common question I hear is what labs are useful or necessary to screen for rheumatoid arthritis? First and foremost, please understand that there's not one lab that definitively diagnoses you with rheumatoid arthritis. And the reason why is because this is a clinical diagnosis, and that means you need to take into consideration a number of things. Do you have a story or history that is consistent with likely inflammatory arthritis? Number two, do you have examination findings that are consistent with inflammation? Number three, do you have labs that could be connected with rheumatoid arthritis as well, which we'll talk about? And do you have any imaging findings, including ultrasound or MRI, that shows active inflammation? So when it comes to labs, there's kind of two different categories. There's looking at antibodies and there's looking at inflammation labs. When it comes to antibodies, the two main ones that are checked are the rheumatoid factor and the CCP antibody. Understand that the rheumatoid factor can be negative in up to 50% of people when they're first diagnosed with rheumatoid arthritis, and can be negative in 25% of people long-term as well. The CCP antibody tends to not be as sensitive for rheumatoid arthritis as a rheumatoid factor, but is definitely more specific. So if you have the CCP antibody and you have some other features that are consistent with rheumatoid arthritis, there's a good chance that you have RA. The inflammation labs, including your sedimentation rate and your CRP antibody, are helpful. Again, they're not 100% in everyone, but in some people, they can be very consistent with not only the presence of active inflammation, but in the future with fluctuating flares and remissions as well. Other labs to consider checking, there are other antibodies that are sometimes checked as well. There's the MCV antibody, that's mutated citrullinated vimentin antibody. There's also the 1433 ETA protein. There's also other antibodies that are being checked and followed for more research-oriented purposes. All these can be helpful. They can make it more likely that you're found to have rheumatoid arthritis, but you still need some of those other features as well. Also, if your physician is concerned that you may have another condition that mimics rheumatoid arthritis, other labs may be necessary. That could include screening for sarcoidosis. If there was concern that you have a condition called multiple myeloma or other similar conditions, they may check additional antibodies. And then lastly, there are other conditions that can cause swollen joints, such as hypothyroidism, that may be screened as well. Really, what labs you need to screen for rheumatoid arthritis? The four most common ones are the rheumatoid factor, the CCP antibody, your inflammatory parameters, your SED rate, and your CRP labs as well. Combine that with a good history, examination, imaging findings. That's how you really make a diagnosis of rheumatoid arthritis. If you found this helpful, subscribe to us, give us a thumbs up. If you'd like to learn more, check us out at chicagoarthritis.com. And if we can be helpful in the future, let us know. Until then, have a good day and live well. Bye-bye.